Imagine this. A virus sweeps across the globe, shutting down entire nations. People panic, governments scramble, and scientists race against time. But behind the scenes, questions linger. Was this natural or something more sinister? From ancient plagues to modern outbreaks, pandemics have shaped our history. Yet some of the deadliest health crises remain clouded in conspiracy and intrigue. Are we simply victims of nature, or is there a deeper game at play? Welcome to the Pandemic Mysteries, where we explore the untold stories and unsolved conspiracies of global pandemics. Buckle up, it's going to be a wild ride. The bubonic plague, or Black Death, claimed over 75 million lives in the 14th century. But what if this catastrophe wasn't entirely natural? Some theorists believe secret societies like the rumored medieval Order of the Black Rose could have played a role. They suggest the plague was used to destabilize kingdoms and consolidate power. Evidence? Historical accounts mention strange robed figures spreading mysterious powders in public spaces before outbreaks. Were they healers, as some claim, or agents of destruction? While most historians dismiss these stories as folklore, the truth remains buried in the ashes of the Middle Ages. The Spanish flu of 1918 killed over 50 million people worldwide. Officially, it was a natural virus, but leaked military reports from the time tell a different story. Some conspiracy theorists argue that the pandemic started as a failed experiment in biological warfare during World War I. They point to reports of mysterious illnesses in Kansas military camps months before the first international outbreak. And here's a chilling twist. Declassified documents from the 1970s reveal that both Allied and Central Powers were researching ways to weaponize viruses during the war. Could the Spanish flu have been an accidental release of one such experiment, or was it a deliberate act? When HIV/AIDS emerged in the late 20th century, it disproportionately affected marginalized communities, fueling devastating loss and stigma. But it also gave rise to one of the most controversial theories in medical history. Some allege that the virus was artificially created as part of a secret program aimed at population control. They point to classified military programs like the US government's MK-Ultra and Project Shad, which involved unethical experimentation on unsuspecting citizens. While scientists have repeatedly traced HIV's origins to chimpanzees in Central Africa, the conspiracy persists, fueled by the lack of trust in global institutions. Is this just paranoia, or does the truth lie in a classified dossier locked away in government vaults? In 2002, SARS emerged in China, followed by MERS in the Middle East a decade later. Both were deadly, but their global impact paled in comparison to COVID-19. Conspiracy theorists argue that SARS and MERS were dress rehearsals, controlled outbreaks designed to test global responses to pandemics. They cite suspicious funding, spikes in virology research, and the establishment of global health initiatives like the World Health Organization's Pandemic Task Force. Could these outbreaks have been orchestrated, and if so, by whom and why? Of all modern pandemics, COVID-19 has sparked the most intense speculation. While scientists say the virus likely originated in bats, theories of a lab leak from the Wuhan Institute of Virology refuse to fade. And then there's the Great Reset. This theory suggests that powerful global elites used the pandemic as an opportunity to reshape the world economy, accelerate digital surveillance, and consolidate power. Documents from the World Economic Forum discussing a post-pandemic world only added fuel to the fire. Is the Great Reset a legitimate plan for global progress, or a conspiracy hidden in plain sight? Vaccines have saved countless lives, wiping out deadly diseases like smallpox and drastically reducing others like polio. But in the shadow of this triumph lies controversy, a story of mistrust, profiteering, and unanswered questions. Take the swine flu outbreak of 1976 in the United States. In a rush to vaccinate millions, pharmaceutical companies developed a vaccine that caused a rare but severe side effect, Guillain-Barré syndrome. This incident shattered public trust and set the stage for decades of vaccine skepticism. The COVID-19 pandemic reignited old fears. Claims of microchips, sterilization agendas, and DNA manipulation flooded the internet. But beneath the more outlandish theories, deeper concerns simmered. Why were governments worldwide signing deals with pharmaceutical companies that shielded them from liability? Why did the prices of vaccines skyrocket, with poorer nations often unable to afford the life-saving shots? In 2021, investigative journalists uncovered contracts between Pfizer and several countries, revealing demands for financial guarantees even in the event of adverse effects. Critics accused Big Pharma of exploiting a global crisis for unprecedented profit. And then there's the story of Event 201, a pandemic simulation exercise held just months before COVID-19. Organized by major players like the Gates Foundation and the World Economic Forum, the simulation eerily predicted the events of the pandemic. Was it just foresight or something more calculated? While many trust vaccines to protect lives, others wonder, are these campaigns purely about public health, or is there an underlying agenda, one driven by control, profit, or something even darker? Big Pharma, the titans of the pharmaceutical industry, are often seen as the heroes of health crises. But behind their life-saving drugs lies a history of scandals, secrecy, and staggering profits. During the AIDS epidemic in the 1980s, drug companies were accused of price gouging, charging exorbitant amounts for antiretroviral drugs. This pattern repeated during the COVID-19 pandemic, with vaccines costing up to 24 times their production value in some countries.
I worked on the vaccine rollout. Let me tell you, these companies weren't just racing to save lives. They were racing for market dominance. Every decision revolved around profit margins, not people.
In the last 2 decades, Big Pharma has paid billions in fines for unethical practices, from suppressing research on dangerous side effects to bribing doctors. So when the same companies promised miraculous solutions during pandemics, many couldn't help but wonder, can they be trusted? And then there's the question of intellectual property. During COVID-19, calls to waive vaccine patents to ensure equitable distribution were met with fierce resistance. Why? Because the patents represented billions in revenue. As millions died, the industry raked in record-breaking profits. While the world suffered, Big Pharma thrived. Their profits soared to unimaginable heights. But at what cost? Are we witnessing the noble pursuit of health or the cold calculus of capitalism? Throughout history, pandemics have been attributed to nature. A virus jumping from animal to human, a bacterium spreading through contaminated water. But what if some pandemics weren't natural at all? In the 20th century, the idea of biological warfare became a terrifying reality. Programs like the US's Project MKNAOMI and the Soviet Union's Biopreparat explored weaponizing pathogens. Even anthrax, a deadly bacterium, was mass-produced as a weapon of war. Fast forward to COVID-19. While official reports point to a natural origin, whispers of a lab leak refuse to fade. A classified U.S. intelligence report from 2021 even suggested a possible link to gain-of-function research, a controversial practice that involves making viruses more potent to study their effects. And COVID-19 isn't the only suspicious case. The Lyme disease epidemic in the U.S. has been linked to Plum Island, a government lab off the coast of New York. Could the ticks that spread Lyme have escaped from experiments? Some believe so. But if pandemics can be engineered, who's pulling the strings? Governments, rogue scientists, or perhaps shadowy organizations with motives we can only guess at? Consider this. In 1977, the H1N1 strain that caused the Russian flu mysteriously resurfaced decades after it had disappeared. Investigators believe it was accidentally released from a laboratory. If it happened once, could it happen again? The implications are chilling. If pandemics can be engineered, we're not just fighting nature, we're fighting human ambition, greed, and perhaps something even darker. Are these outbreaks accidents, acts of war, or calculated moves in a high-stakes game of power and control? Pandemics are moments of fear, chaos, and loss, but they are also moments of revelation, forcing us to confront the systems and secrets that shape our world. Are we pawns in a game we don't understand? Or are these just stories we tell ourselves to make sense of tragedy? The truth is out there, if we dare to find it. Thanks for joining us on this journey. Don't forget to subscribe, comment, like, and share for more documentaries that celebrate the world's most incredible stories. See you on our next episode.
Silent whispers in the air, feeling lost without a care. Nature's breath comes slow and deep, healing wounds while we sleep. Hands that hold and hearts that mend, love's the key, our only friend. Waves of hope begin to rise. Look within beneath the skies. Heal the world with gentle grace. Light the shadows every place. Break the chains of fear and woe. Let the healing waters flow. Dance of stars, the moon's sweet call. Catch us when we fight and fall. Rise again with love's embrace. Find the light in every face. Strength in unity we find. Every soul entwines the mind. Gentle voices guide the way to a brighter, peaceful day. Heal the world with gentle grace. Light the shadows every place. Break the chains of fear and woe. Let the healing waters flow. Dance of stars, the moon's sweet call. Catch us when we fight and fall. Rise again with love's and woe. Let